My name is Eve Miller and I'm a JCU student, or James Cook University student from Australia.
My name is William. I'm also a James Cook University student from Townsville, Australia.
My name is Vanessa. I'm also a JCU physiotherapy student. I live in Australia in Townsville now as well, but I'm from Canada, from Vancouver before that.
They've got a partnership with our university in Townsville, James Cook University. So I believe one student each year from EUSES goes over to our university in Townsville, and each year 3 students, which is this year's us 3, get to come over to Girona for 6 weeks or so. We do a bit of study here at EUSES and then a 5-week practicum at 2 of the hospitals here in Girona.
Yeah, I think that physiotherapy is practiced a bit differently here than in Australia. Like in Australia, often you'll see one patient on their own for maybe 30 minutes, or if it's their first session, it might be up to an hour. Whereas here, at least at where we've been so far, the physiotherapists tend to have multiple patients at the same time, and they'll sort of be doing a couple of things with a few patients simultaneously, or they'll have one patient working on their own exercise program or receiving some sort of electrotherapy, whereas in Australia it's more they come in, just see the physio on their own, and then head off from there. But as far as the cultural experience, we've met lots of local people and met other students and some of the staff at our practicum, and gotten to see a little bit of the area nearby, visited Barcelona for the day, or hoping to go out to the coast on the weekend.
It's also allowed us to get a bit more practice with the electrophysical agents, so the electrotherapy. We are taught about it in Australia, but it's not as heavily based as what it is here. So in relation to TENS, interferential, magnetic therapy, which we'd never seen before, so it was cool to get a little bit more practice in that area, because we've touched on it back in Australia, but it's not something that we really use every day. Depending where you work, you can, but it's been good to be able to get a little bit more practice in that, which we'll be able to take back to Australia and use as well. So that's been really good as well.
And then also just the communication side of things as well, having to learn to communicate with people from a different language and different background. It's been really interesting and a challenge for us all to start learning a new language and trying to put that into practice as well. It's been really good.
We've learned some Spanish as well. A little.
So in Australia at our university, it's a 4-year degree. First year is just your general anatomy, learning the basic concepts of physiotherapy, and we also do a few other general subjects with other health professionals such as occupational therapists, physiologists, sports physiologists, and we learn general communication skills along those lines. Then as you move up into second year, you start to generalise into physiotherapy a bit more and break away from the other health professionals. So in second year, we start looking at neurological physiotherapy, and it's more of learning the assessments, what the conditions are, and that's just in our first semester. And then in our second semester, we then begin to specialise even more, looking at cardiorespiratory physiotherapy, musculoskeletal, and just really building our basis for physiotherapy. Then in third year, those same subjects again, just building off them more, learning even more conditions, more treatments, how to deal with more complex cases that may be a mixture of neurological and cardiorespiratory, and how you can, as a physiotherapist, how you can help with their rehabilitation in that aspect. And then moving on to the second half of third year is when you begin your practicals, so going out and beginning to actually work in a hospital, work in a private practice, getting some real hands-on experience with real patients. So we do 6 placements that are 5 weeks each. So you do your first half in the end of third year, and then your second half in the beginning of fourth year, which is where we're at now. So we have one more when we go back to Australia, and then after that we're back at university for a short semester, which consists of final exams, just getting everything ready, and then we apply for jobs and hopefully get one.
Yeah, definitely. We've really enjoyed Girona itself as well, and we've all done a few different things as well. Like I've done a bit of cycling, and I brought my road bike with me from Australia, and I've done a couple of rides on my own just from what I've found online, or gone with people that I've met as well, which has been really cool. And the landscape is so different from Australia, so it's been really interesting to see that. And the roads here are quiet, and it's just perfect for cycling here. And yeah, the other guys have done a couple of different things as well.
Yeah, and the experience at Capwell so far as well has been really interesting. Like we've said before, it's quite different to how things are in Australia, and it's good to see those differences and the differences in culture and all those little things. It's very interesting. I found that quite good to come over and see, so I'd definitely recommend it to all the future students that will come along.
Yeah, I'd definitely recommend it as well, especially if you want to get a bit more out of your practical experience with physiotherapy. So back in Australia, you get a lot of experience in different areas, but you don't really get anything like this. You don't really get a chance to see how different cultures practice and the different ways that, even being at the university, the difference between the teaching. So if you really want to expand and build off and try and bring something from Australia to here and take something from here back to Australia, I definitely recommend this as a placement to try and do.
I think for me as well, it's also given me a deeper understanding and appreciation for communicating with people from different cultures, and when there is that language barrier, and understanding the difficulty of trying to communicate an idea or to communicate, for if we encounter patients in Australia who English isn't their first language, I think that we've acquired a deeper appreciation for what that feels like to be the one who you don't know the words to communicate what you're trying to say. So that for me has been one of the big things that I've got a better understanding of that now.
Yeah, it allows you to kind of be on the other end
Yeah.
of when patients can't quite tell you what they're trying to communicate, and you're like, But yeah, so it's good to be able to see the other side of it almost.